Hello guys, welcome back to my channel. Today I am going to talk on the topic steam inhalation. So let's know first what is steam inhalation. So steam inhalation is an application of moist heat to the respiratory passage and may be plain or medicated. Inhalation may be for a long period or given for a short time at specific intervals. So steam inhalation is an application of moist heat to the respiratory passage to remove the spasms from the respiratory passage or from the lung, whatever the collection. So after giving steam inhalation, it will help to remove all the collection from respiratory passage and it will clear the airway. That is the meaning or definition of the steam inhalation. So let's see what are the purposes of steam inhalation. Why steam inhalation is important to give to a patient. So number one, to relieve inflammation of mucous membrane in acute colds and in sinusitis. To remove the inflammation, to remove or relieve the inflammation of the mucous membrane. Then number two, to soften thick tenacious mucus and to help its expulsion from the respiratory tract. Example, bronchitis post anesthetic patient. To soften thick mucus from the respiratory passage to release the respiratory passage from the mucous membrane. Example, the bronchitis patient and the anesthetic patients after surgery. Then number 3 point, purposes to warm and moisture air in acute bronchitis, whooping cough or after tracheostomy. Then next point, next purpose, to relieve the spasms of the mucous membrane of the larynx and trachea in group. Then last purpose, to relieve congestion and edema of the larynx. These are the purposes of steam inhalation. Let's see the indication. Indication means reason or causes why steam inhalation is to give in which cases we should give the steam inhalation. Like number one, sinusitis. When there is sinusitis patient, when there is inflammation, sinuses inflammation, so if we give steam inhalation, it will clear the air passage. Then next, edema of the larynx, and when there is edema or swelling in the larynx, at the time also steam inhalation need to give. Then next, thick mucus in chest, or when there is mucus collection, thick mucus in the chest, so after giving steam inhalation, it will release that mucus from the chest or from the respiratory passage. And then next indication is acute bronchitis. In case of acute bronchitis, steam inhalation necessary to give. Next is whooping cough. The patient who is having whooping cough, so in steam inhalation after giving, so patient will get relief from that problem. Then last is after tracheostomy. Again after doing tracheostomy, so steam inhalation is have to give. These are the indications of giving steam inhalation. Our last point, last indication, that is spasm of the membrane of the larynx. When there is spasm present in the larynx, membranes of the larynx, so steam inhalation have to give. These are the indication. Next is, let's see the contraindication. When there is indication present, so there will be always present of contraindication. So number one, carcinoma of lung patients. Contraindication means in which cases we should not give steam inhalation, that is carcinoma of lung patient. Who those patients CA present, carcinoma, cancer present in the lung, so that kind of patient should not give this steam inhalation. Next, very young and very old patients. Very old patient means or very young patient, young children, so steam inhalation they cannot bear, and very old person also they cannot bear the steam inhalation, they cannot take the deep breath. Then next, high fever patient. Those patients have high fever, that kind of patient is contraindicated to give steam inhalation. And last point, patient with severe headache. And those patients have severe headache, serious headache, that kind of patient also contraindication of steam inhalation present. So let's see the inhalation are given either dry or moist. this steam inhalation, either you can give dry or another we can give moist. The number one, let's see, dry inhalation. What are? So inhalation of general anesthetic, example ether, chloroform, nitro oxide. So these are inhalation of general anesthetic. These are the dry inhalation. Number example is dry inhalation is what? Ether, chloroform and nitro oxide. Then next, oxygen and carbon dioxide inhalation. So we know oxygen is a dry gases, and so carbon dioxide and oxygen also is a dry gases. So in case of that also, these are the dry steam inhalation. The next is inhalation of volatile drugs. So volatile drugs also under dry inhalation. Then next, inhalation of stramnios, stramnium and the aerosol spray. So these are all are the dry inhalation, example of steam dry inhalation. The next is the methods used for giving steam inhalation. What are the methods? Through how many methods we can give steam inhalation to the patient? The number one is by jug method. Next, steam tent or by electric steam inhaler. These are the different method of giving steam inhalation. Let's see drug use. What are the drugs we can give in steam inhalation? Like number one, tingerbenzone, that is 5 ml per 500 ml of boiling water. Per 500 ml of boiling water, we can give tingerbenzone 5 ml. Then next, eucalyptus, that is 2 ml per 500 ml of boiling water. Then next drug is eucalyptus, so that one we can give 2 ml within 500 ml of boiling water. Next is methyl salicylate, few drops 500 ml of boiling water. So methyl salicylate will give only few drops, that is also in 500 ml of boiling water. The next medicine, next drugs, that is methyl few crystals, that is 500 ml of boiling water, that is methyl menthol. So menthols we can give only few crystals. In small crystals we will get in the menthol bottle, so that only few crystals piece we will give in 500 ml of boiling water. And last medicine, that is last drugs, camphor, few crystals. These are also camphor. This is also camphor. Also we will give only few crystals in 500 ml of boiling water. These are the drugs. So what we can use in steam inhalation during giving steam inhalation to the patient. So these all about the steam inhalation. Hope you understand. So next time I'll bring in new topic. So till then, like, subscribe, follow my channel. So thank you for watching my video.